The federal government says measures have been put in place to make primary healthcare centers in rural areas attractive for health workers. The Minister of Health, Dr. Ehanire, said this in Abuja during the World Health Day as the World Health Organization turned 75. The theme of the 2023 World Health Day is Health for All, strengthening PHC to build resilient systems, while the theme of the World Health Workers Week is investing in the health workforce. Ehanire said that health workers prefer to practice in cities, thereby depleting manpower in healthcare facilities in rural areas.
To date, more than 4,000 primary healthcare centers have been revitalized so far, while working towards a new primary healthcare model equipped with staff quarters, solar power lighting, and assured potable water supply to enable 24/7 service provision to citizens. These steps have improved primary healthcare services in Nigeria and reduced challenges that women face in childbirth and also in addressing home emergencies.
Ehanire added that the federal government had urged state and local governments to establish schools of health technology where rural health workers would be trained. He explained that workers could be trained in local languages to enable them to easily communicate with the rural citizens.
I want to use the opportunity to call on states in Nigeria to remove embargo on employment of health workers, including young doctors for primary healthcare centers and community health workers, and also to invest in generally increasing human resource for health in their states. Otherwise, there is a barrier to our vision of achieving universal health coverage and improving the quality of care. I also call on all stakeholders to ensure that more frontline workers are recruited so that we can ensure substantial reduction in shortage of health workers at this level.
Dr. Walter Mulombo, WHO country representative to Nigeria, said that WHO Nigeria, in collaboration with the government, had been achieving notable strides in keeping the people safe and serving the vulnerable population.
WHO is also working with member states, learning from the COVID-19 pandemic to drive a new pandemic treaty and hopefully get the whole world better prepared for future pandemic. We've been working with the Nigerian government to strengthen health system, to improve routine immunization, to increase coverage to treatment for killer infectious diseases, but also to start planning on how we will drive health through the demographic transition. The population in Nigeria, like in many countries in Africa, is increasing at an alarming pace.
Mulombo listed areas of achievement to include combating infectious diseases, HIV treatment, reducing maternal mortality, increase in life expectancy, and supporting disease eradication.
And the public services, social services, do not keep the pace. So if we are to avert future catastrophe, it will be important that as we engage into the next 75 years, we also take that into consideration. Health has so far been considered as a consumption good, not as a human right, basic human right. It should be considered as an enabler in the context of social and economic development. We need to put health at the center of all our undertaking.
USAID will continue to work closely with the federal and state ministries of health and primary health care agencies at the national and subnational levels to support health workers and health training institutions in Nigeria